Good afternoon.
Good afternoon.
Thank you. Well, I always like to start with a bit of a personal story because I come from a line of providers, but myself, no interest in joining that field. I didn't want to practice medicine, but growing up, there was a few words that always stuck into my head. Many thanks for your consultation, yours truly. Those are the lines that my father often used to close his dictations, those words etched into my childhood. And like many kids, I lived for the moments my dad would come home after work, ready to throw a ball, shoot pucks, just spend some meaningful time together, but most nights didn't always look like that. He'd come home, rush through dinner, and then disappear into a mountain of charts and notes that stole time not only away from me, but from himself. And don't get me wrong, I have a great dad, and he always found a way to make time for me, but that came at a cost. It meant late nights, early mornings, and sacrificing his own rest just to keep up. Unfortunately, this story isn't unique to my family, and it's becoming the story for many healthcare providers across the country today. My name is Jacob Lester. I'm a co-founder of MiiHealth AI, and we are working to solve one of healthcare's most precious resources, time. This is time for more authentic patient-provider interactions, time for shared decision-making, and less pajama time, the time our providers spend at home within their charts and notes so they can spend it with their loved ones. Because when we talk about healthcare innovation, we think a lot about systems, but it's more than just a systems problem. It's a human problem. A problem that's accelerating due to this digital transformation of medicine, where our proliferation of the electronic health record has increased our data access and coordination, which has been great, but at the same time, it has simultaneously amplified our cognitive and administrative burden on our physicians, which is resulting in this burnout and threatening the stability of our workforce. I always like to put some numbers behind this because those providers, those like my father, are spending nearly half their time on these administrative tasks. And for every hour they spend with a patient, 2 hours gets lost within the electronic health record, so now they're losing these valuable clinical hours to documentation rather than care. And this doesn't just affect our providers. It has a direct adverse effect on our patients because when providers spend more time within the electronic health record than they do with their patients, patients feel it. They feel it because they repeat the same information over and over again, and they often leave that visit feeling like they weren't fully heard. And when this problem begins to exist at scale, it doesn't just impact individual visits, it also begins to impact the health system. And health systems feel it through reduced throughput, longer wait times, missed opportunities for care delivery, and increased operational strain on what are already stretched care teams. And this, too, directly affects patients. And this is where I'd like to introduce you to DAINA, our solution. And DAINA is our dynamic AI intake navigation agent who we've built with these providers for them. And she's not a chatbot, but a true intelligent clinical partner that fits seamlessly into workflows. So how does DAINA transform what we know as a patient visit today? Well, we can see here a brief visual representation of DAINA in action as she conducts an autonomous conversation with a patient prior to their visit with a provider, dynamically adjusting those questions in real time based on each response. She's able to capture complete clinical histories using the patient's language of choice, and then takes that conversation and contextualizes it down into a structured clinical note, which highlights all those key insights and red flags for the provider. For the patient, this is often the first time they're able to tell their full story without being rushed and without feeling like they're taking up too much of that visit that's already such a big time constraint. They can take their time, they can speak their own language and know they're being heard. And this allows every visit to then begin informed, focused, and ready for meaningful care. Today, intake starts when a patient walks into the clinic, but with DAINA, it starts before they even enter the four walls of the health system. A provider is able to create an order where DAINA will automatically reach out, first with a text to let the patient know they will receive a call to complete their intake, and then she will call them and guide that patient through a natural conversational intake process from the comfort of their own home, or maybe it's on the phone on the way to work, whenever they have that time to do that intake. And throughout that conversation, she adapts questions to make sure she collects full clinical histories, symptoms, or any specialty specific information that is required for that visit before it begins. So by the time they walk through that door, the work of intake is already done. And the provider is able to view all that beforehand, walk in, and focus on meaningful, valuable care discussions and consultations with that patient. Now, what makes this possible is how DAINA is built. And she's not a script or a chatbot. What she is an agent who's built and trained to behave like a member of the care team. When we build these agents, there are three core components. This is the persona, goals, and output. Persona defines how the agent, or DAINA in this instance, interacts with the patient, her tone, empathy, trust. Goals defines what must be accomplished in that conversation. Not just a checklist, but true structured milestones. And output is what transforms that conversation into the structured note that is within the electronic health record. All before the visit takes place. So what you end up with is not just a conversation, but a real, meaningful, clinical outcomes ready before that visit begins. But we can sit down with providers. We can build out these agents. We can make sure they fit into workflows, but what do patients think? How do they feel about interacting with these AI agents? How would they talk to DAINA? Well, what we did was complete a clinical study with Mayo Clinic where we saw 250 patients, and of those, 233 completed their patient survey. What we found was 93% found DAINA easy to use. 82% felt comfortable sharing that information with DAINA. They trusted her. And 79% reported that their provider actually spent more time discussing their care and care decisions than they typically would collecting standard information. For providers, we saved an average of 8 minutes per patient encounter. And across a 16-visit day, that's roughly 2 hours of time saved. But what matters most is not the time that's being saved. It's what that time creates. And what it creates is what we like to call the triple win for providers, patients, and the health system. For providers, it's less administrative burden and more time practicing medicine. For patients, it's more meaningful interactions and better care. And for the both of them, it transforms the dynamic of that visit because the provider is able to walk in fully prepared, focus on care, and be fully present, practicing medicine the way they train to. And for the health system, it improves throughput, it improves utilization, and it improves their overall efficiency. Because at the end of the day, it's not just about saving time. It's about restoring that human side of healthcare because every patient deserves to be fully heard. Every provider deserves more time. And in my instance, every kid deserves to hear, "Let's go throw a ball." Thank you so much for your time and attention.